Randy Richmond from London Free Press. Could you point us to evidence showing that drugs that are given out for free are ending up in the hands of children?
Oh, I don't have to. You just have to ask the police, and even the so-called experts have now been caught on television or on tape saying that they're being diverted. And in BC, the Public Health Authority, which has been a great advocate of this radical scheme, has admitted that it's ending up in the hands of children. Adam Zivo from the National Post has done intrepid reporting on this, where he's shown that the cost of a hydromorphine tablet has dropped on the street, has dropped by like 95%, because as soon as the addicts get the drugs, they resell it so they can buy something more potent, and it has being handed off to kids. So look at what the public health activists and even there's one so-called doctor here in town who was caught on tape admitting that there's diversion of those drugs. So the evidence is in, and it's final. And I would also encourage the media to be more responsible. It is just so irresponsible for you to go and quote people who profit from the ongoing drug crisis as though they are experts. They are not experts. If they were experts, their policies, which have been implemented over the last 9 years, would not have caused 40,000 deaths, would not have seen an over 100% increase in opioid overdoses. The last thing they want is for the crisis to end, because they're making so much money off of it. We've got to stop feeding the activist class and start providing treatment and recovery. I would encourage you, if you're going to cover this drug issue, stop talking to the people who caused the problem. Start talking to the recovery centers. I would ask, why don't you ask the people, when you interview them, why don't you ask them, how many people have you got off drugs? Call them up, the local public health authorities, ask them how many people they've gotten off of drugs. Because it's interesting, the media rewards these people for the carnage that they're causing. You call them experts. They're not experts. They're expert only at one thing, and that is perpetuating the drug crisis. Their policies have been implemented for the last 9 years, and we see the results. The experts are the people at places like Harvest House in Ottawa or the Oak Centre in Winnipeg, where they bring people in and get them off of drugs. Let's start quoting them as the experts. Thank you.
Thank you. Next question.
Good morning. Andrew Lawton, True North. I know you're familiar with Alberta's approach to drugs, which similarly to you is very much against so-called safe supply, but they have proposed a forced intervention, and in some cases really using the mechanisms of law to push drug users into treatment under certain conditions. Would you support something like that nationally?
I don't know. I need to study it more. I need to understand how it would work. I want everybody who's on drugs to be in treatment and rehab to get off drugs. What I haven't been able to figure out is, if someone doesn't want to be rehabilitated, can you require them to be? I don't know. I'd like to see some evidence for and against before I make a judgment. Tracy Gray from BC is an MP in our caucus, a common sense conservative, who's proposed that we have treatment in the prisons and that judges have the ability to make it a part of a sentence that drug-related offenses have drug treatment as part of the sentence, so that the offender, who perhaps they were involved in theft, we know the theft was linked to their addiction, the judge could say, while you're in prison, you're required to be drug-free, and we're going to provide you with high-quality treatment behind bars. That makes sense to me, because they're already going to be in prison anyway. They might as well be cleaning up their body and their souls and their addictions. But I don't know if you can take someone off the street who has not committed a prison offense and successfully rehabilitate them. If we can, I'm open to it, but I need to see more evidence at this point.
Thank you. Next question.
Craig Needles from Blackburn Media. You mentioned some of those rehab centers and the work that's being done there. How would you go about getting more of those open, and in a timely manner as well? Because there are people who are using Safe Supply right now that if all that was just cut off all of a sudden, they would be in a very difficult situation. It could be a life and death situation when it comes to withdrawals. So how would you be able to do this quickly? Because OHIP-funded rehab is still very difficult to find, and a lot of these people are clearly struggling financially.
That's a very good point. It is too hard to find right now. And that's why a lot of people don't get help. They try. You know, they call a 1-800 number, they dig around, family members go scrounging around to try and find out what's available. They're then told that it's $40,000 to put someone in a treatment, Sebastian, in a treatment facility. So I appreciate that it's very hard for people to get into these programs. But that's why we need to repurpose the money that's now being spent on unsafe supply and harm production. Stop giving money to academics, bureaucrats, activists, and others who are perpetuating the problem, and fund the treatment facilities so that they can expand. We have treatment facilities. The problem is there are not enough of them. So, you know, if you went to the places that have proven track records of getting people off drugs, and you said, if we repurpose some of the money we're already spending, could you expand your service to more people? That I think is the best way to do it. And as I would do across government, I think we should pay for results. We should pay organizations that actually get results. The result is to get people off drugs. And as we get closer to the election, we will have more details on how we will repurpose those dollars to put them into treatment and recovery to bring our loved ones home drug-free. Thank you.